Good afternoon, everyone. I think you all know me. I'm Christy Snuggs, the Deputy Director with the Division of Child Development and Early Education. We're glad you joined us today. And I'm going to let the other folks that I have with me from our regulatory section introduce themselves. So I'm going to turn it over to Tammy Barnes.
Need to unmute. I'm sorry. Hey, everybody. I'm Tammy Barnes. I am the Regulatory Services Section Assistant Director at the division, and welcome everybody. Lori and Andrea, you want to introduce yourself?
Hi, this is Andrea Lewis. I'm a Senior Manager of the Regulatory Services Section.
Lori, unmute.
Hey, this is Lori Pugh. I completely lost the sound. I haven't heard anything from the beginning, so I'm sorry.
We're just introducing ourselves, Lori. So.
Introduce yourself, Lori.
Okay, so I'm Lori Pugh. I am one of the senior managers in the Regulatory Services section.
I think that's all we got because we can't get Allison on, Christy.
Okay. Well, good afternoon, everyone. Welcome again. And I am thrilled to be with you this afternoon to talk about something that's all near and dear to our hearts, which is technical assistance. And I think we have with us, I've looked at the participant list. It looks like we have some of our coaches from our Health and Safety Resource Center that work with our child care health consultants. And we have some leadership from that organization as well. And then we also have our regional managers with our child care licensing. And then we also have representatives from our TA program, our R&R agencies from across the 14 regions. So we are very, very glad that we have you, and we may have others that are on the call as well.
Christy, we do have our supervisors are on there too, licensing supervisors. And
I knew there was more than just managers. Thank you, Tammy. And we have our supervisors. So welcome to all of you. I would just like to start by saying that we're here today to talk about technical assistance and how we might need to move forward and what positions we're taking as far as technical assistance during the middle of a COVID crisis or in the middle of a pandemic. And then I also want to take this opportunity to thank each one of you for all of the tremendous work that you've been doing throughout the last 8 to 9 months and before that as well. But thank you for continuing to support our child care workforce and our providers across the state, because they could not do this work without each of you. So thank you so much for that. So what we'd like to do today is really just talk for a few minutes about TA. I do not believe this is going to take our complete 2 hours. Tammy and I talked a little bit about that, and I know we're a few minutes late getting started. And part of that was we were having some technical issues, but we also wanted to allow everyone to get on, because now we have 103 participants, and when it was time to start, we only had about 44. So hopefully everybody has joined, that is going to join or in the process, and we will jump right in. This is not this is for us to share information and to talk a little bit more. We would ask that if you have questions to put those in the Q&A as we're going through the presentation, but there should be plenty of time at the end to address any questions, and we can unmute you during that time should we need to. So again, thank you for being here. Thank you for the work you're doing. And I think now that we have, looks like the numbers have stopped, we'll just jump right in. So I wanted to start the conversation this afternoon and talk about where we are with technical assistance and what we're doing in the state of North Carolina right now. So I think all of you are aware that the division and our regulatory area, we've resumed monitoring visits for childcare facilities back in September. And as we began those monitoring visits, what we have found is that there might need to be some technical assistance provided to support health and safety practices. We know that we have been very diligent and in updating the health and safety protocols and the interim guidance that goes out. We actually are in the process of getting an updated version of that out tomorrow or by Monday at the latest. We are now updating that on a monthly basis. And the nice thing about the new updated health and safety guidance is that as we're updating it now, and many of you on the call have contributed to those updates, and we really appreciate you telling us what the issues are and what are some of the concerns or some of the challenges that you may be working with. But we are updating that on a regular basis, a monthly basis. And now in the table of contents, at the bottom of the table of contents, it does specifically state the changes that have been made so that a provider doesn't have to go in and reread the entire guidance again, even though that might be a nice thing to do just to keep it fresh in our minds. It does show where those updates are made. And so again, we thank many of you who have been involved, giving us the feedback of where the providers find it confusing. Our child care health consultants and their team helping us to clarify many of those answers. We couldn't have done that without you. And so that is being updated. But as we have gone out and begun these monitoring visits, we have noticed, our consultants have noticed that a number of our programs are not doing some of the health and safety practices to the level that they should. The main things that we have seen are they may or may not be conducting health screenings upon entry into the facilities. And if they are doing it, some of them may not be doing it 100% according to the guidance. But probably one of the bigger issues that we're seeing is that many of our staff in our child care facilities are not wearing masks. And as you well know, the guidance does address both of these issues. It does say that these health screenings need to be conducted. It is required, and that all child care staff in a child care facility, whether it be a center or home, should be wearing masks. And then more recently, what we're seeing as schools have started back and as many of our child care centers, many of them have expanded the number of school-age children that they're serving, or they've set up remote learning sites. We're seeing that many of the school-age children are not wearing masks. And so those are really three areas. There are some other concerns that our consultants, our licensing consultants have noted, but those tend to be the top three. And again, all three of those are outlined specifically in the health and safety guidance that says they are required. Now, one clarification and one new development that I want to make sure everyone is aware of is that right before Thanksgiving, I believe it was Wednesday, the 25th, right before we left for the Thanksgiving holidays, the governor did update his executive order. And within that executive order, it is now required that all children age 5 and above, whether they're in school or not, there was originally, it was only school-age children, those 5-year-olds that were actually enrolled in public school. But now any 5-year-old that's in a child care facility is required with the new executive order to be masked or to have a cloth face covering on them. That is an update that is coming out with the December guidance. but I did want to make all of you aware of that. And that is something that I'm pretty sure Tammy has shared with her consultants and supervisors and managers. And that's just something that we're going to need to work with our childcare facilities to make sure that they are enforcing that rule. And that was in response to, of course, the growing numbers of COVID cases that are being identified across North Carolina and across the US and around the world. So we are seeing through these visits, we are seeing that there are some issues with health and safety. Now, I did mention earlier that we resumed these visits in September, and I will say that as we have moved forward, we have seen that the numbers of programs that actually have these concerns are continuing to be less and less. And so while as we talk further today and we think about how we're going to roll out a plan to support our facilities, what I want you to know is that the numbers in the big scheme of things, because just to give you an update of where we are related to childcare, is that we have about 92% of our centers now open. Centers and homes, I'm sorry, I should have combined the two, of our facilities now open. Centers are right at 90% and our homes are closer to 95%. But we do have about 90 to 92% of our facilities open. And what we're seeing is that these concerns are limited. We don't believe that there's going to be a huge number of facilities that will need additional technical assistance, but there may be some. We also realize that it is just a time where health and safety just needs to be re-emphasized. As we have seen the growing number of cases, more and more people being hospitalized. We've had, unfortunately, this week, 2 deaths that we're aware of in childcare facilities of teachers or owners or directors. We don't know for sure that they contracted the illness at the facility, but we do know that we've had some deaths, and we're seeing these reports across the state. So we know that it's our job to make sure that health and safety is a priority. Our whole goal behind talking about technical assistance today is to make sure that we're creating safe places for educators, for the children, and for the families that we serve. So with that being said, why we wanted to have you on the call today was to talk about what we want to do. We want to be able to provide a support system for our childcare providers. And what I mean by a system is they have been, I'm sure, my health and safety, my childcare health and safety consultants will agree, they have been calling them throughout the pandemic. They've been calling, they've been asking questions. We have communicated, and I think people are aware of the childcare health consultant that serves their facility. But they are limited in their numbers and the work that they can do. They are medical health experts because most of them are nurses in those roles, and they are have very good understanding of the illness and what symptoms might need to be involved and what are the best health and safety protocols. So that's one part of this support system. But then we also have our childcare consultants, licensing consultants, who have been making visits, who have been in constant contact since the beginning of the pandemic with their facilities. They've been reaching out, checking on numbers, checking on how things are going. And then we also know that there is another component of this that we want to engage at this time, and that is our childcare resource and referral, who in collaboration with our childcare health consultants and our childcare licensing consultants, we really, really are asking you to help us to provide some much needed TA regarding health and safety protocols. So I think most of you have seen the document that was created that talks about interim CCR&R technical assistance and training guidance. If you haven't, we can definitely send that out after the call today. But I think all of you have been made aware of that. And so what we want to do is we want to find a way to support our child care providers. They are overwhelmed. Many of them do not have appropriate staff, or they cannot find appropriate staff to do the health and safety protocol the way we need them to do it, or they're struggling to stay within ratio to make sure all the cleaning and disinfecting is done appropriately. But what I can say is that childcare was very well equipped to deal with this pandemic from the standpoint of disinfecting and cleaning, because much of what we've asked them to do is pretty much what they were doing, maybe just do high traffic areas or high contact areas a little bit more often, and with their cleaning protocols. So what we've seen is, yes, we've had cases, but we also know that the children that we're serving in our child care facilities are the ones that are least likely to show symptoms and least likely to contract the illness to any great peril. But of course, there's always those concerns, but we do believe that our health and safety protocols that were already required by our licensing guidelines and rules has created very safe environments. And even though we've had cases, in comparison to other types of arrangements, we have fared very, very well. So our child care licensing consultants are not citing facilities at the present time any violations for not adhering to these health and safety protocols or adhering to the interim guidance that has been provided. However, at some point, because it is our responsibility to enforce and to make sure that our child care facilities are following and keeping children safe, we're going to have to start citing violations. But before we get there, this is the next step to making sure that we provide support to those facilities. It's sort of like, you don't want to be caught on the carpet for something that you don't feel like you've been properly trained to do, or something that, we haven't provided enough assistance for. So we want to provide as much support for our facilities as possible. And so what we want to do is we want to go back into our child care facilities, either virtually or face-to-face for a very limited time, and we'll talk more in detail about that in a minute. And we want to provide this support around health and safety only. So as we start thinking about TA as a system, what we're thinking about right now is only providing limited on-site technical assistance around health and safety practices only. We are not ready to open it back up to greater technical assistance face-to-face in any other way except around health and safety practices. So as outlined in the document that you all have seen or will see, what we have identified is that as our licensing consultants are going into the child care facilities, what they're going to do is they're going to notate any of these issues that they're seeing with health and safety. If they think it rises to the occasion that there needs to be additional support, they will then reach out to the lead agency and the child care health consultant for that facility and get you all on a call so you can talk about what is the best approach to support this child care facility. Now, please understand that our licensing consultants are already doing consulting and technical assistance while they're there. And if it is something that's small that they can correct while they're on site, they're going to go ahead and do that. If they feel like that there is additional support needed, they will take the first step in making that director aware that they're going to refer them out for additional support. Then the child care licensing consultant will coordinate a call with the Child Care Resource and Referral Agency and the CCHCs that support that center or home, and you will get on a call and you'll figure out what type of support might be needed. What we have heard from our child care health consultants is that many times if there is an issue or if there's a question that a child care licensing consultant may not can answer, that they answer that question, and then as they start talking to the director or the administrator at that site, they find out that it gets a lot more complicated, that there are other concerns and questions. So that's why we want our health consultants involved in these conversations. However, we also know that our health consultants are not used to maybe working or guiding directors on how to help parents or maybe even their staff really understand guidance expectations. So we see the R&Rs as one of the things that you are great at, and one of the pieces that we see fits very well into your wheelhouse would be that type of thing, helping to guide the directors on how to help parents understand these health issues and why we're doing the things we're doing and why we need to follow these health and safety guidance expectations. And then after that conversation happens with that team, then one of them will reach out to the child care facility that needs the additional support via a phone call. And the whole idea is that we want to work with our directors. This is really about getting that buy-in, getting that understanding from the director so that they can then implement it into their facility. So that would be a telephone call or a Skype or a Teams or a whatever you're using meeting, Zoom, and you would have that conversation. It might be that the health consultant, the TA from the R&R, the licensing consultant could all be on a virtual call and you can handle the issues virtually. But there might be an occasion that would require someone to go into the facility. If that's the case, we've outlined guidance related to what we would like you to do. If there is a need for on-site technical assistance, we ask that you limit any type of visit to a center for no more than 60 minutes. And as we were talking about this, since this guidance was written, one of the things that we talked about with the numbers increasing, if that amount of time could be less, then make that amount of time less. But sometimes, you know, the facility, the director may want you to come in, they may want to make that contact, they may want you to see something that they're talking about that they're really not able to show you over a virtual call. So there might be a quick visit to that facility. If there is the occasion that you might need to go into a classroom, very similar to what our licensing consultants are doing, we ask that you limit that time to 15 minutes or less, or even less than that if need be. And we only ask that there be some type of, if there does need to be TA or some type of additional support, that there would only be limited to on-site visits to one program each day. So you would not be going to the various programs within the same day so that you wouldn't expose yourself and so forth. We do believe that we can do this safely. I'm sure many of you are saying, you know, you're just talking about all these numbers increasing. Are we really going to be able to do this safely? What we know from the experts, and I'm sure there's people that know a lot more about this illness on this call than I do, but what we have found is that if we follow the 3 W's and we wait 6 feet apart and we wash our hands frequently and we wear those very irritating masks that we all hate, but if we do that, what we see is that the numbers go down dramatically as far as, and the risk of contracting the illness go down to a lot less, or not even an issue at that point. So we just really want to encourage you that if there is a occasion where there might need to be an on-site visit, that you follow the health and safety guidelines. You encourage everyone to use the 3 W's, and we really, really do believe that you will be safe. But follow up, any type of work that can be done via phone calls or virtual platforms, we encourage that as well. So that is really the emphasis of the TA portion that we want. The other piece of what we would like to ask you to do is that we also want to work with our local communities, and our licensing consultants or our supervisors will help in this, our child care supervisors. But we want to go back and resume our directors' meetings. And my understanding from talking with many of you that in some communities, this is already scheduled for this month, or maybe have already had a meeting. Again, these meetings can be done virtually, but we want them to be set up so that we can really come in and have these conversations. And at those meetings, we want to make sure that we're including our licensing consultants, that we're including our TA folks that are helping in those communities, and also our child care our child care health consultants, because providers need to see that we're working on this together, that we're trying to support them, that we are all in this together, that we are trying to provide every bit of support that we possibly can, and really helping them, like I said, to have safe places for the teachers and the other staff that are working in the facility, that we have safe places for the children to attend because their families have to work, and that we are ensuring families that they're leaving their children in a safe place and keeping our families safe. So really 2 things that we're asking. One is we would like for you to think about how we might begin to do this support system of TA. If our child care licensing consultants see that there is a need, and again, we think this will be limited. We think it will be a few cases here and there, because what we're finding is that many times it's not that the people don't understand it, it's just they maybe were not aware that this change had been made and that now 5-year-olds are needing to wear masks. Or maybe they thought they were doing it right, but they're not. And once we tell them, they're usually pretty conducive to changing. So we think that it'll be few, but when that happens, the licensing consultant will again let the program know that they think that they might need a little bit of extra support. That child care licensing consultant will then convene a virtual meeting with the CCHC, the health consultant, and the TA. They will create a plan, and then they will reach out to the director in an introductory call to talk to them. And after that, then if there needs to be on-site TA, we would move forward with that. That's the first step. The second step, or the other thing that we're asking you all to do, is to really begin. Our expectation would be after the Christmas holidays to set up directors meetings, and that all 3 of these groups get together and participate in those director meetings, and that this TA that we're providing and these directors meetings, that there would be a focus on health and safety so that we can have health and safety environments for our children. So that's what we wanted to talk about today. I know that was a lot, and I know I've talked a lot, but hopefully I've made it clear. And I'm going to ask Tammy if there's anything that she would like to add, and then we want to open this up for any type of questions or concerns, and just for us to have a conversation. So Tammy?
Hey, Christy, I was trying to get off mute. Sorry. Yeah, no, I think you covered everything. I just want to restate that what Christy said about, I really don't think there will be a lot of these referrals. Basically the consultants have already been referring providers to the child care health consultants during this whole pandemic. The big difference now is that I will be the ones making the referral. We'll be coordinating that TA from child care health consultants and the R&R staff. And, while I know that, the child care health consultants will deal with the health part, I think that the R&Rs will be most helpful in helping us with the safety part, like Christy said, particularly around, coming up with some TA practices around how to work with parents during this pandemic time, and how to help these providers understand why masks are so important. It's not that they're don't know how or don't know that they're supposed to. They're just not wearing them. And sometimes when you really make an effort to help people understand the why around something, they'll do it more. So I think it's real important for us to come up with some good talking points about why we are asking people to wear masks. And, one of the biggest reasons is it's in the executive order that all businesses or their employees are supposed to wear masks, and at some point we are going to be held accountable for this if COVID keeps going in the direction that it's going. And they need to understand that we're trying to help them so that they do the right thing and not get violations in the future. That's all I have.
Thanks, Tammy. So I'm just looking at a couple of the questions that I've seen, and they're asking how often do we want to see directors' meetings and so forth. And then I think that's really up to you all, but I think my recommendation, and Tammy, I'm curious as to yours, we are updating the toolkit on a monthly basis. So I'm thinking a monthly basis, at least through the short term on this, as we're trying to get through the pandemic, makes sense, especially now that we can do those virtually. Does that sound reasonable to you, Tammy?
I think typically we do directors meetings every quarter or every 5 or 6 months. So I don't know how feasible it is for us to do something monthly. I'd have to, see what the supervisor and manager's thoughts are. My thought that I've already told my staff is that at the end of January, first few weeks in February, they're to put together a director's meeting to truly, to see where we're at with COVID and to talk health and safety issues at that time, have the child care health consultant there, have the R&R staff there, answer any questions that providers have, and then see where we go from now. I don't know that we want to make a commitment for every month right now, but right now we need to do a big one at first to make sure everybody's participating, all the providers, and then see where we go from there.
Yeah, and I think that's a good recommendation. I think that we need to figure out in our local communities how best to get updates out. I mean, we're sending them out for the state, but I think it probably needs to be reinforced at a regional or local level. So we might just need to think through how to do that, even if we're not convening a meeting. But we definitely can look at that. But I think our intention, as Tammy said, is that we definitely want this to happen the latter part of January or by the 1st of February, or first couple of weeks of February at the latest, so that we really can get this information out and get everybody on the same page. We have spoken internally, and we are probably that by, I don't know, we don't want to give a set date, but by the middle, right at the beginning of the spring, we're probably going to start citing violations. So we want to make sure that we have this first meeting and get any TA that needs to be done as our consultants are out visiting and they see it, so that we are preparing them that eventually, if these things don't change, we are going to have to start citing violations, because children have to be in a safe environment. And we owe that to the families, that we're making sure we're doing everything to keep our children safe and to keep our teachers safe, because we don't want to see more deaths or more outbreaks or clusters in our child care facilities. The other thing that I would mention, and I don't know if anybody has specifically asked this question, but I think these sometimes these are better to be done per community or per county than a big regional meeting, just because the people know each other. I know that may put a little bit more pressure on some of our health consultants because some of them serve multiple counties. But if there's any way we can do it by county, I think that would be the better way to do it. Tammy, would you agree with that? I think instead of in a regional approach, I would hope that we would do it by county level. Is that your expectation as well?
Yeah, that's how we typically do directors meetings.
That's what I thought.
Set it up in their county.
Yeah. Okay. They said, Tammy, you were a little garbled when you said who would be making the referrals. The child care licensing consultants will be making the referrals, and they will notify the director of that site or if it's a family child care home, the home provider, that they are going to make that referral, and then they will facilitate getting the CCHC, the health consultant, and the R&R person together on a call of some sort to create a plan of how they're going to support that facility. Correct, Tammy?
That's correct.
We've got a comment that they love the idea of directors meetings are starting back. They feel like that's so important, and they do believe this would be the absolute best way to get the new guidance information out. All right, so that's all I see in the chat. Let me see if there's any in the Q&A. I don't see it. Well, I don't see any right now. Oh, yes, I do. I lied. He said, we will share the document. Yes, Tammy, we'll send that out to all of the lead agencies. I thought it had been sent out, but we can make sure that happens.
I don't know who's asking that question. I believe the lead agencies all have it. My staff do not have it. I sent them an email giving them my instructions in an email, but they have not seen that document.
Okay. We do our directors meetings monthly in our county. We add in our consultant every couple of, this is hard to read. I can't see it. Let me enlarge my questions. It looks like they include their consultants, not every time they meet, but every couple of meetings. Is that still okay?
Well, I think for this first meeting in the end of January, 1st of February, they need to coordinate everybody being together at it. And it doesn't matter to me who takes the lead in it, whether it's us or the R&Rs or the child care health consultants, but they all three need to coordinate when and how they're going to do it.
Okay. All right. Oh, shoot. I just lost my screen. Okay. Has the division provided child care centers with an ongoing supply of both child and adult masks? The division has provided the adult masks. They have not provided child masks in most situations. We have a limited amount of dollars that have gone into PPE supplies. And what we have heard is that the adult masks are the ones that they have been requesting the most, but we definitely could look into child masks if that becomes an issue. Okay. Okay, they're saying, Tammy, that they are experiencing, and as they talk to child care providers, especially homes, they are under the impression that they will be in violation of licensing rules for offering sensory activities like Play-Doh, sand, and water play to children, even if they provide individual containers. Is that true?
That is true right now. It's what it says in the guidance. We have not changed that. That's something that, you and I talked about, but I don't think it's been changed in the guidance at this time.
Right. So right now, providers should not be offering sensory type activities related to Play-Doh, water play, and things of that nature. that we will let you know when that changes. So that right now would be cited, correct, Tammy?
Yes.
Is that one that would be cited currently if they are doing that? It does not matter that it's in individual containers. They would still have a violation there. It says, will the local partnership staff that typically provide TA be notified in one of our centers need the extra TA support, or will the support be provided outside of what we do with the centers? So that is a really good question. We have had a conversation with our local partnership, NCPC and the EDs as well. Currently, this is a partnership with our R&R agencies and the child care health consultants. So they would not be in that initial communication because this is the partnership that will be working together on this. However, I mean, there's nothing to say that that can't be communicated to the local partnerships. The idea is that we want to be a supported team and be able to, make sure that our providers have the support that they need. But this particular program that I just talked through would not be notifying the local partnership per se as part of this, but that's something that could easily be done if you're an R&R within the partnership and wanted to include that. That is all that's just even more support of what's going on.
Or if during the initial conversation with the licensing consultant, the CCHC and the R&R, if they feel like that person needs to be included, then they can certainly do that at that time.
Okay. Do we need to follow up with centers about 5-year-olds wearing masks? I think anything we could do to get that message out would be great. That is brand new development. And, that means that in many of those 4-year-old classes, I told Tammy this yesterday, if I was in that 4-year-old class, my birthday's in January, come January, if I turned 5, I would have to start wearing that mask. So that would be something that we need everybody's help in getting that message out. So yes.
However, let me say this, because the new guidance has not come out yet and they have not seen it in the guidance, they're not going to do it until they see it in the guidance. So, I think
the guidance will be out today or tomorrow.
Yeah, we can certainly promote it, but until they see it, they're, that's how it'll be.
Right. There was mention that it's also, as we plan those directors meetings, that it's also very helpful to have health department staff attending. I think that's great. I think you can make sure whoever you normally have, I say add, but our goal is to make sure that at least that we have a child care licensing consultant from the division, that we have a health and safety consultant there, which is what we're helping to fund to provide health guidance for our facilities, and that we include the R&R for any TA needs, that it's a united support system that we're helping those providers. But I'm not saying eliminate anyone else. We need everybody at the table that needs to be there. Yes, Amy, we will share the document. I thought Jackie had shared that with you all. She does have a copy, correct, Timmy? But we'll get that out.
I don't know who has a copy of it.
At this time, there's question about, are we able to provide general TA in limited capacity, such as 15 minutes in a classroom? Right now, the division is saying that we only want TA around health and safety concerns. So not regular TA on site. Right now, all we want is health and safety TA.
However, other TA can be done virtually.
Yeah, it can continue to be done virtually, just not face-to-face. There is in the new guidance that is coming out as well, one other piece that I would clarify is back during the onset of the pandemic, there was language in the guidance that allowed health providers, physical therapists, speech pathologists, folks of that nature to come in and work with children if it was necessary. With the updated guidance that is coming out in the next day or so, or by the first of next week, it does specifically say that TA providers could be allowed in if that's needed to deal with health and safety, as well as the licensed consultants and others. So that will be covered there as well, in case someone was worried about that. Yeah, and Teresa, thank you. Teresa Sterningson mentioned that we are working with the DHH staff and others that hopefully very soon, as Tammy mentioned, that the sensory activities will change and we'll be able to go back to those. But right now that is not, right now sensory activities are still prohibited. Yes, that is correct, Amy. Right now, just to clarify, the mask requirement, according to the executive order, should be observed in childcare for all 5-year-olds, not just those enrolled in school. It's all 5-year-olds. And it will be reflected in the new version of the guidance. And what they're saying is, with the mask, it would be nice if we could look at children's masks, because now the 5-year-olds having to wear them in childcare, that does become an issue. In the past, it was not required that any children in childcare wear masks. Now the 5-year-olds, except school-age kids, now the 5-year-olds will have to. We have already begun the process of sending out the PPE, the second round of PPE, and the child's masks were not in there. So we will need to wait. Hopefully we'll get another federal package that will help us. But right now we do not have any more funding to be able to provide that. But that is definitely something we will keep in mind as we move forward. There's a question, Tammy, can you briefly explain how, there's just all these questions popping up and then I can't read, how a provider would be in a violation of something that is in the toolkit that's listed as guidance? It's not a rule.
If it's just a recommendation, we wouldn't cite anything anyway. And right now we're not citing any violations. We're not planning on doing that until after probably starting in March, but we would only cite a violation if it is a requirement, either in the executive order or in the guidance.
Tammy, what about outdoor sensory areas? Like if there's a large area that has sand as a, a safe fall zone, because kids naturally will dig and play in that. Is there an issue with that in outside environments?
The guidance says no sensory activities. It doesn't say indoor or outdoor. It says no sensory activities are prohibited. Actually, I think it does talk about outdoor activities also, but them falling in a fall zone would not, I wouldn't consider that a sensory activity, but playing in the sand.
Right, you wouldn't want the children to be playing in the outdoor sand areas. Right. Okay. Let me go back to the chat. There's some more questions coming in there. Regina, I am going to ask you, my chat has disappeared. Can you help me with those questions?
Sure. Take the mask off. Okay. Let's see if I have anything else that came to me. Basically, what I was sending were the items that came to me privately. So
okay, I got it back. But if you can do it, go ahead and start, and then I'll jump in.
All right. Did you do the one? The monthly directors meetings? Who do you expect to take the lead on planning and hosting those?
I believe, and Tammy, I'll let you refer to this, but I believe that you have instructed your staff to set those up, those directors meetings. The first one, is that correct?
That's correct.
So the child care licensing staff will take the initiative of setting up that first one at the beginning of the year. And then I think we can work locally as to how that would be conducted as in the future, correct, Tammy?
Yes.
And two different people have asked about, can we get a recording of this meeting?
Yes, we are recording it. We can make that available.
And the problem with outdoor sandboxes are that they cause congregation of children in a small area. And that's from Lisa.
Oh, that's a very good point. Thank you for, probably one of our health consultants helped us with that. If we're thinking about the social distancing, when you have a sand area, the problem is that you get a lot of kids congregating in that one area, which would be in direct violation of some of the social distancing guidance.
I would recommend that the providers cover them if they can to keep the children out of it.
Can the partnerships be invited to the directors meeting, please?
Yes, they should be. I would think partnerships, health departments, whomever else we feel like are needed need to be at that meeting. Yes.
And that's the last item I'm showing in the chat. Here's another one. So just to clarify, all family child care homes should also be wearing masks, and children age 5+ for the duration of care as part of the HMS guidelines.
Tammy, do you want to take that as far as family child care homes? Where,
Yeah, if it's a 5-year-old there, they have to wear them.
but the teachers in the family child care homes should be wearing them as well.
Right, but I thought the question was, does 5-year-olds in a family child care home have? Yes, they do.
And yes, there is a question related to 4-year-olds. If you have a 4-year-old classroom and some of the children are 4 and some of them turn 5, yes, I know that's different than what it is right now, but according to the new executive order, if they turn 5, they have to wear masks. Part of that is a 5-year-old is getting ready for school. They're at that level that they can understand the mask. They're not going to hopefully be playing with them as much as a younger child would. So they do believe that by that age, they would be capable of keeping a mask on.
As a follow-up to Tisha's question in regard to the 5-year-olds at family child care homes, she asked all persons, all day.
For an adult, the executive order states that any business, all their employees have to wear a mask during working hours. So a family child care home is a business, just like a center is a business. And so they are required to wear a mask all day during their working day.
What would the guidance be regarding centers that have sand as a base on their playgrounds?
I don't think there's a whole lot. I don't think there's a whole lot we can do with that. I mean, except that it's more supervision of the children and just asking them not to play sand, opposed to walking around and going from equipment to equipment, that kind of thing.
In the TA PD guidance, page 1, it mentions that TA should be focused on enabling the director to comply and speaking with families to comply with program and state requirements. Are we interpreting this as we are expected to communicate with parents?
I think I missed something, Gina. Tammy, did you understand the question?
I don't think that the expectation is that they communicate with parents. The expectation is that we help our directors to work better with parents and help, and the directors would be the ones speaking to the parents.
It's just that I think our thought is that, that's as an R&R, as a TA and an R&R, your role could be to help directors understand how to communicate with parents and so forth. But no, the expectation would not be that you would talk directly to the parents.
Right.
Is that all that I saw that I see, Regina? Do you see any others? Does anyone have a question that we haven't answered, that you want to type in? Is there any confusion? Does everybody understand that basically we do want to start back doing TA related? I just want to reemphasize, we do want to start back with TA related to health and safety concerns only in a face-to-face environment, if that needs to happen. And the way we will know that that needs to happen is our child care licensing consultants who are going out making monitoring visits, they will be making referrals. And of course, if a child care provider called you directly and asked for some, you would want to help them. But the way this process would work is we want to provide support to those that the child care licensing consultants are finding issues with. Again, we believe that most of our child care consultants can handle most of these issues. A lot of times it's just explaining to them why this is important, and corrections are made on site, and we don't think there'll be a lot of referrals, but there may be some. And as a result, that child care licensing consultant will inform the administrator at the facility or the family child care provider that they're going to refer them. And then the licensing consultant would take the responsibility of convening a conversation with the child care health consultant and the TA person for that facility. And then you would work together to figure out a plan of how you might help this person, or the child care consultant would tell you what the issues are. And then you would work out a plan, and then there would be an initial reach out to the director or administrator or family child care provider. And then it might be that all three, well, we would want all three to work together, but it might be that you could handle that virtually, or if there is a need to go and do face-to-face, that you could go and do face-to-face. We just ask that that be limited, and we talked about those requirements. So that's the first piece. And remember that face-to-face TA should be around health and safety if you're doing it face-to-face. You can still do TA virtually in other capacities. And then the second thing that we're asking you to do as part of this support system is to make sure that we reconvene our directors meetings. And thank you to all of you who are already doing these. And Tammy Barnes has instructed her consulting staff that they are to take the responsibility for setting up these meetings. And they will be in touch with folks to make sure that those happen in the early part of next year, so that we can make sure that all of our child care facilities have been given the same information, been given an opportunity to hear it, to see us all working together to support them and to understand that we're there to support them. And then, of course, they may still just reach out to you individually to ask questions as needed. Tammy, anything you'd like to add?
Oh, I don't have anything.
All right. Well, we really, really appreciate all of you taking the afternoon. We did finish in just right at an hour, which is what we thought. We will make sure that we get the information, the document out that I referred to folks if you do not have that. We also will make sure that if you want the recording, we'll get that to you. If you want to just drop an email to me or Tammy Barnes or Christy Snuggs at dhhs.nc. Actually, I can type it. I'll type our emails in here. Or Tammy, can you do that real quick while I'm talking? We'll type our emails in. If you want to just drop us a quick email, we'll make sure we get you a copy of the recording or any information, or if you have follow-up questions. We thank you for all the work that you've already been doing. And we thank you for being willing to collaborate with us. Do remember to look for the new health, interim health guidance. It should be coming out in the next day or by the beginning of next week. Remember that in the table of contents, it does show what the changes are, but two of the big changes that will be in the new December information is that 5-year-olds in childcare will need to be masked, and that it also says that TA providers, childcare health consultants, licensing consultants can be in the classrooms and providing on-site TA if needed. We thank you again. Thank you for being with us. Hopefully, all of you had a great Thanksgiving holiday. We hope you have a great rest of the week, and we wish you all happy holidays and some needed rest and time off in the next couple of weeks. Stay safe and be well. Thank you.
Thanks, Christy.